This day is meant to sensitize and educate citizens about tuberculosis, as well as celebrate the gains made in the fighting of the disease, without leaving out the challenges and how they can be overcome. As of 2021, an incident rate of 319 out of 100,000 people, meaning 59,000 people each year get TB in Zambia. Having that record and 4,000 dying each year, Zambia is not wishing to remain behind in this fight, as the government and non-governmental organizations are each day doing something to better the TB rate and to lower the infections in the country. Health Minister Sylvia Masebo confirms the concerns that government has over TB.
We lose not less than 4,000 lives. We are aware that at the center of the high burden of TB disease and mortality are the gaps in awareness levels, misconceptions about TB, and that we still miss a significant number. It is for this reason that we highly need to raise the desired awareness.
Health championing and community-based organizations thought of gathering in public to share more about the disease, and in Lusaka, the event was being held in a football field where various activities were going on, such as screening of TB, provision of medication, and aerobics, among others. Julius Kachiza was among those that attended this event.
This day means a lot to me, having suffered TB before and having been cured. I spent it with my civil society colleagues who were running to end TB and to ensure that people are living healthy lives.
For Isaac Piri of Community Initiative for TB, HIV/AIDS and Malaria, plus related diseases, Sitam Plus, an organization that deals with TB advocacy, has used the day to fulfill a national campaign called Run for TB, running 59,000 kilometers, representing the number of TB infections in the country each year.
So the idea is to run 59,000 kilometers virtually, meaning to say that people have to run using the apps on their phones.
In the wake of COVID-19, Sitam Plus says the pandemic has had a huge impact on the organization's work.
TB screening was affected, intensified case finding was also affected, so we did not find as many cases as we were finding before the COVID-19. Linkages to the facilities, there was actually a drastic drop because we were not doing the work. Also, the treatment adherence support was affected.
But the organization still sees light at the end of the tunnel.
Luckily enough for Sitam Plus, we had an innovation. We introduced the e-dots, where we trained a couple of community-based volunteers to use phones to be able to ensure that they communicate with the patients that are on treatment.
And Julius Kachiza, a TB advocate from Lusaka province, shares his thoughts on tuberculosis in Zambia.
And this is why it's important that we step up the fight against TB, because if we fail to step up, we will be abandoning the 2030 goal to end TB as a public health threat. We cannot continue to stand on the sidelines while people around the world, and Zambia in particular, fall ill and die from a preventable and curable disease.
A dedicated community worker and counsellor, Mr. Kachiza, further notes these concerns over TB.
And that's why we just hope that the replenishment meeting, which will be happening in the USA this year, will raise enough funds which will be invested in tuberculosis.
Are we seeing an end to TB anytime soon, as a country, as a continent, or globally? Considering that there is a set global target of ending TB by 2030.
We are failing to find those TB suspects who might be in the community and continuing to spread the disease. We need to step up the fight, and that's why the gains right now in Zambia against TB, they're not up to date. Sometimes resources also are lacking.
Realistically speaking, 2030 is too soon. Unless if we really invest, only then can we see some tangible results. Of course, the country has made some tremendous progress, but if we are missing 4,000 cases per year, for example, that is huge.
It is called World Tuberculosis Day and commemorated annually, remembering the year 1882 when Robert Koch, doctor, announced his discovery of Microbacterium tuberculosis, the bacterium responsible for the TB disease. Reporting for the SABC's Channel Africa in Lusaka, Zambia, I'm Arthur Davis, Scopo.